Uterine fibroid embolization is a minimally invasive procedure. UFE does not remove the uterus or the ovaries. A small incision is made in the leg to gain access to the femoral artery. A long flexible tube called a catheter is then inserted into the femoral artery. It is guided up the femoral artery and into the artery that supplies blood to the uterus, called the uterine artery. The catheter is then guided to smaller arteries that supply blood to the fibroids. Uterine fibroid embolization delivers tiny microspheres to the artery that supplies the fibroids, cutting off the blood flow, causing the fibroids to shrink. The tiny microspheres are injected through the catheter and travel through the blood vessel. Since the microspheres are more than 60 times larger than red blood cells, they plug the tiny vessels that red blood cells travel through to feed the fibroid. The procedure is repeated in the uterine artery on the other side to make sure that all blood supply to the fibroids has been cut off. All fibroids are treated simultaneously. Once the blood supply to the fibroids has been blocked, the fibroids begin to shrink. There is no scar tissue and minimal blood loss with UFE. Recurrence of the fibroids with uterine fibroid embolization is rare. Most women are able to return to light activity within a few days of the UFE treatment and are usually back to work and normal activity, on average, within 11 days. Take back your life today. Ask your doctor if uterine fibroid embolization is the right treatment for you.
Many of the women we take care of have really similar problems. What they'll complain about is that the fibroids have completely taken over their lives. What these women will tell us is that many times they'll have to wear pads and tampons at the same time. Some women have to go to bed at night to keep from bleeding through to the mattress. The fibroids can also interfere with sex and intimacy because of pain and bleeding. Many of the women are exhausted because of the anemia that comes from the fibroids. It can even lead to depression. This can also affect, of course, the family. So now you have a woman within the family who's exhausted, bleeding. So this makes it very difficult to be, to do the mom, to be a mom, to be a wife. So fibroids really affect the whole family. My name is Dr. Kevin Carson. I'm a fibroid treatment specialist with the Georgia Vascular Institute. Uterine fibroids are benign tumors of the uterus. They're very common among many women in the American population.
My name is Tanika Gray Valbrun, and I am the founder of the White Dress Project. So Dr. Carson came to one of our events that was held at the 12 Hotel downtown, and he spoke on one of our panels, and he just really empowered women to share their stories and really to get second opinions. And that's what I really valued about him, that he said, you don't have to just come to me. You can see other doctors who will be willing to give you a second opinion, and you make the best choice, based on your family and based on your health condition, you make the best choice for yourself. So I really respected that, because not a lot of doctors will say that, and not a lot of doctors will offer that advice.
Although all women suffer from the symptoms of uterine fibroids, women of color especially suffer from many of the more severe symptoms such as the bleeding and pain of the pelvis. As many as 70% of women suffer from uterine fibroid, and that extends up to 80% within women of color, predominantly African American and Latin women.
Unlike a lot of women, I realized that I had uterine fibroids very early, probably around the age of 14 or 15. And lucky for me, I was very familiar with fibroids because my mother had them, so she shared her experiences with me. I saw her go through losing 2 sets of twins because of fibroids. So I was very familiar. So when I started to experience the symptoms around 14 or 15, I knew what was happening, but I still kind of delayed the process all through college and really just dealt with it and realized how much my quality of life was being sacrificed. So fibroids can really affect you on a day-to-day basis, because as a woman, I think we're taught that we're supposed to keep it classy and sophisticated, and we're not, really supposed to talk about health issues, much less, talk about your period, especially if guys are around. Like, don't even do it. So the daily dealing with fibroids is really a feeling of, trying to mask the shame, really, that you feel like this disease causes you, because you can have so many accidents that can be visible to other people. So it's really important that you know what's going on and be your own health advocate. And that's really one of our strongest missions with the White Dress Project, is to empower women.